Program. For the first time, the World Hospital Congress is being hosted in South Africa. This year is the 10th Congress. The Department of Health will partner with the International Hospital Federation, that's the IHF, and supported by the Hospital Association of South Africa, as well as the Board of Healthcare Funders. The Congress started on Sunday at the Durban International Convention Centre. And this morning, joining us from our Durban studio is Terence. He's the National Organising Committee for the 40th Hospital Congress. Good to have you on the programme. Welcome to you, Terence.
Good morning. Thanks for having me.
Good. I mean, Terence, the first time that this Congress is being held on this continent, this is a big moment for us, no doubt.
It's an absolutely historical event. The organisation has been in existence for 87 years. The Congress has been held in all continents, various countries across the world. But for the first time, we have the honour of hosting the Congress in South Africa. So it's quite an historic event, but also opportune for South Africa as we embark on major health systems reform. So we are really looking forward to the proceedings and the outcomes of this event to assist us, in fact, to better deliver health services in our country as we support other countries to do the same.
Yeah. When we look at the theme this year, and I'm reading that it's addressing the challenge of patient-centered care and safety. Obviously, this is it's a huge theme that's not only relevant here in South Africa but around the world as well. When it comes to service delivery in hospitals, that sometimes is lacking very, very severely within the healthcare sector. Talk to us about some things that are going to be discussed.
So some of the things that will be discussed include things like improving patient care and involving staff as well as patients in improving healthcare service delivery. It also talks about using health technology to improve service delivery and the delivery of healthcare. It also talks about how do we ensure that we have the appropriate and best leaders and managers to be able to manage health services. How do we use health technology? How do we use various forms of innovation to ensure that health services are delivered better, with better quality, but also better outcomes? In other words, to ensure that the patient experience is better, that patient safety is adequately addressed, that we reduce the incidence or adverse incidents, that we reduce medical legal litigation. We don't only make health services better in terms of quality, but also more affordable. How do we do more with less? How do we ensure that patient waiting times are reduced? So all of those are aspects that will be dealt with as part of the proceedings of the conference.
Is this addressing both private and public sector hospitals?
Yeah, so the International Hospital Federation is an organization that is a member organization for more than 100 countries, as well as associations. These associations include both the public as well as the private sector. As a matter of interest, the incoming president of the International Hospital Federation is the president and the chair of the private health sector in Brazil. In our case, the conference is being hosted by ourselves as the National Department of Health, but in collaboration with the Hospital Association of South Africa, which represents the private health hospitals in South Africa, but also the Board of Health Funders that largely fund services that are provided in the public sector. So we're talking about improving healthcare both in the public as well as the private sector.
Yeah, good. It's good to hear. It really is. Now, in terms of the countries that are attending, I know you mentioned that there are 100 member countries. Will they all be present? I mean, this is going to be a massive congress, no doubt.
We have the majority of the members of the IHF present, but very interestingly, and we have ensured that this particular congress, because it is the first time that the congress is held on the African continent, we have for the first time in the 87 years of existence of the IHF, we have the largest contingent of African countries being represented. So we have countries represented from all across Africa. We have more than 13 countries from Africa for the first time in this Congress. And then we have countries from all continents. So all continents are represented at the Congress. So we are a completely represented organization and Congress. But we also have major organizations that are also participating. The World Bank, the World Health Organization, and so on. So apart from countries represented and organizations, we also have multilateral organizations represented at the Congress.
Fantastic. We wish you the best of luck. Keep us updated as to some of the events that do come out of this. And we do hope that it's a great benefit for the health sector, learning from other countries and member countries that are a part of it. Thanks for joining us here on the program, Terence, talking to us about this World Hospital Congress that's being hosted for the very first time in South Africa. It's the 10th Congress of its kind, focusing in on healthcare issues around the world. All right, let us take a break here on the program, and we'll have more after this. Stay tuned.